And so different patients have different goals for their vision afterwards. For some, it may be seeing a golf ball 100 yards down the fairway. For others, it may be seeing the computer screen. Really, three different options. In option number one, we would set both eyes for great distance vision. And so that way for driving, for seeing faces across the room, seeing that golf ball down the fairway, you're going to have the best vision possible. But for up close, you would need some over-the-counter reading glasses to help you see that computer screen and things that are closer. Option number two helps you become less dependent on the reading glasses. And so in that option, we would leave your dominant eye. Everyone has one eye that's naturally a little stronger than the other. And so we would set your dominant eye for distance, and we would intentionally leave your non-dominant eye just a little bit nearsighted. So there is a little difference between the two eyes, but when both eyes are open, that difference is so small that most patients don't notice it. And what they gain is freedom from glasses for seeing their cell phone or computer screen. The final option is called a multifocal implant, and there are several different models. The most basic form is a bifocal, and some of the newer ones are trifocals. And basically, it's a bifocal or trifocal that gets implanted inside the eye. That way, both eyes can see far away and up close. It sounds like that may be the best option, and it is for a lot of patients, but it's not for others. And so part of the preoperative consultation process is an evaluation to see which lens is most suitable for your eyes. And at Magruder Laser Vision, we're really specialists in making sure that we select in a discussion together the right option for you.